I think we should be testing more patients, and that's the basis of this study. So we set up the Universal Breast Cancer Genetic Registry. We tested patients with 80 genes instead of just 1 and 2. We also compared patients that were in the 80 genes to the 11 most penetrant genes in breast cancer. The data's been updated since the abstract. We now have 713 evaluable patients. The registry has over 1,000 in it, but all the data is not back on it yet. So of those 713, the patients who met NCCN current guidelines had a 10.2% deleterious mutation rate. Those who did not meet guidelines had an 8.6% pathogenic variant rate. That is not statistically significantly different. And if you look at patients who have VUSs, they were essentially the same variants of unknown significance in the two groups. If you look at actually the genes in each of the two groups, on the right-hand slide you have the patients that meet NCCN guideline testing. They're set up to find BRCA1 and 2 and the other higher penetrant genes. BRCA1 and 2 in this graph are in blue, and then the higher penetrant genes are in variants of pink. And you can see they do a pretty good job of picking up the higher penetrant gene set. The green here are lesser genes that are still associated with breast cancer and have management guidelines, and the yellow right now have accruing guideline that are evolving. And if you look at the genes look at the graph on the left, these are the patients who did not meet NCCN guideline criteria. Didn't pick up any BRCA1 mutated patients, but there were BRCA2 mutated patients in this group. We also had a significant number of the highly penetrant genes, especially in CHEK2 and in ATM. But really what you're picking up are these lesser penetrant genes, but still have management guidelines available. So overall, there is no statistically significant difference between the two groups, but they pick up different genetic variants. So in summary, breast cancer patients who do not meet current NCCN testing guidelines have a pathogenic variant rate of 8.6%. Universal genetic testing of all breast cancer patients will identify many more patients harboring pathogenic variants, and these are significant variants that currently have management guidelines. Expanded panel testing yields way more pathogenic variants than BRCA1 and 2 testing, or even in the expanded breast cancer panels up to 11 genes. Patients who do not meet NCCN testing guidelines have a different spectrum, as you saw on the charts, of pathogenic variants than those who meet guidelines. So our conclusion is economically based guidelines for genetic testing of breast cancer patients are anachronistic, miss a significant number of pathogenic variants, and we believe they should be abolished immediately. Thank you.
All right, thank you.